Hospitals across our state are stretched to the max. Hospital system leaders tell us they're running out of beds, having to treat some COVID-19 patients in beds in ER hallways due to all of the infected people. Tonight, our state's public health officials are offering grim warnings about the next few weeks and begging people to get vaccinated to slow the spread of the virus.
Hey, you guys need a hand?
And people are often taken care of these days in a bed in a hallway.
Less than ideal conditions to treat COVID-19 patients. What was the exception before the pandemic is now commonplace, says MaineHealth's Chief Health Improvement Officer.
Our hospitals in Maine don't have that many rooms. How many more beds can we put into a hallway?
So are we in crisis mode now?
Oh, yeah. Oh, yeah. I mean, we are definitely in crisis mode, and we have been for a while.
Hospitals across Maine are dealing with hundreds of COVID patients, including those who are no longer contagious but still need hospital-level care. That means Maine's record of 330 patients with the virus is actually underreported due to how the federal government defines who is a COVID patient.
People that got hospitalized 2 to 6, 7 weeks ago, some of them are still in the hospital, but they're no longer showing up in those numbers. We are surging as much, almost as much as we can.
We're seeing a lot of unvaccinated 40-year-olds.
Now, even Maine's rural hospitals are filling up. Early in the pandemic, most COVID patients went to urban area hospitals.
But now we're able to take care of patients closer to home in our rural hospitals, particularly if they're not critically ill. So we're able to do it. And we also really need to do it because we need to save, for instance, the beds at Maine Medical Center and our bigger hospitals for those who are really critically ill.
And those hospitals are running out of options. 33 critical care beds are left. While hospitals can flex regular beds into ICU beds, that is reliant on two important factors: equipment and staffing. And Maine is dealing with a healthcare workforce shortage.
We just don't know how much more we can do that.
The big concern now is the expected spike in people testing positive for the virus after the holidays. Public health leaders worry that spike could also lead to more people going to the hospital with the virus, stretching our hospital staff and resources even more.